are studying now, those who are reading or practicing or whatever.
Good evening, everyone, and welcome to ATP Live. Today is a special one because we're going to be talking about female genital mutilation. Sorry, I'm in the wrong. Sorry, I'm in the wrong one on Instagram. I'm just going to quickly set up my Instagram. Welcome, everyone. I'm going to try and see if I can get my Instagram started. Okay, good evening, everyone, and welcome to ATP Live. For those on Instagram, I hope you can see me now. Sorry, I went wrong in the wrong one before. Okay, so welcome to ATP Live. And I'm just going to quickly share this to all the various platforms, and then we are good to go. Just give me a couple of minutes, and then I'll make sure that all our groups have the live video on, then we can start. Just give me a couple more minutes. Okay, my videos. Okay. Welcome, everybody. Welcome, welcome. If there's someone that should be on this video, all the months on ATP. Yesterday we had a poll about female genital mutilation, and it was quite enlightening for me to see what people say. So, please invite them now. Let them come and join us. Let me just make sure that the videos are pinned, and then we can start. And those on Instagram, welcome. Okay. That's the pediatrician. Okay, I can't find my live video. Okay, if somebody can find my live video on Ask the Pediatrician, can you pin it for me? Okay. Welcome, everyone. All right, then let's pin to the top. Okay, I guess it's at the top. I can't even see. Okay, let me just check that the last video I put is at the very top. Okay, I think it is. Okay, good. Okay, so we're going to start now. Invite friends, invite family. Welcome to ATP Live. Today is going to be very interesting one. Okay, where's my video on ATP itself? I can't find it. Okay, yeah, I've seen it. Okay. Okay, so I think I'm set now. I was going to see if I can do some um I'm going to see if I can go do my uh live audio room, but I don't think that works today. Maybe I'll do it another day. Okay, so let me go back to my stream yards. Okay, I can see most of you are here already. I can see your comments. All right, so welcome everyone. I'm Gbemisola Boyede. I'm a pediatrician and I'm the CEO of Ask the Pediatricians Foundation. And yesterday, the 6th of February 2022, in fact, 6th of February every year, we celebrate what we call the International Day of Zero Tolerance to Female Genital Mutilation. So today's ATP Live is a special ATP Live, and we're going to be talking about female genital mutilation. Okay, so it's a very important topic, and even though you have questions, I will answer them. So, but I want us to talk more about female genital mutilation today and ask me questions about that. I'll also give a brief intro and overview of what is female genital mutilation or FGM or female circumcision. It has many, many, many names. So, we're going to talk about that today, and then we'll talk about uh, how we're going to end this practice because it's a very, very dangerous practice for us as girls and as women. Unfortunately, it's still a practice that is widespread, especially for us in Africa, Asia, and all that. So yesterday we celebrate the International Day of Zero Tolerance to FGM, and I did a poll on Heart the Pediatricians Facebook group. It's a group of over 700,000 parents, and I'm happy to say that about more than 6,000 women took my poll, and out of these women, more than close to 5,000 of them uh, are no longer circumcising their girls. That is good. However, I still see quite a lot of women, and I felt so sad that even in this 2022, we still have women who are circumcising their children or who are practicing some form of female genital mutilation, and they still kind of challenge why can't they do it, why not. So we're going to talk about it today, and I hope at the end of today none of us will practice any more female genital mutilation. So feel free to invite friends, family, let everybody join us to watch. If you have any questions about female genital mutilation, you can put it down in the um in the comment section, whether you're watching on YouTube, whether you're watching on Facebook, whether you're watching on Instagram, whether you're watching any of our platform where you're watching from. I hope you can hear me, hope you can see me, and I hope you are ready to learn about female genital mutilation today. Okay, because it's the International Day of Zero Tolerance to Female Genital Mutilation. So tag your friends, tag everybody, let them come and let us try and deal with this topic. I will answer some other questions you may have, but for the first half hour, I'm just going to deal with FGM, and I'm going to. So let's start talking about FGM. So FGM, what is FGM? So FGM is also known by several other names. So people call it female genital cutting, People call it female circumcision. People call it, well, I think FGM is the most popular name for it. So, what is the definition of FGM? For those of you who are watching me on YouTube and Facebook, you can see my banner. Unfortunately, for those on Instagram, I won't be able to type very fast, so I won't be able to answer that question. You may not be able to see my display and my presentation. So, female genital mutilation comprises of every procedure, all procedures that involve altering or injuring the female genitalia for non-medical reasons. So, anything you do to the genitals of a girl or females for non-medical reasons, it is referred to as female genital mutilation. And I love this definition because yesterday a lot of mothers were telling me, oh, do you, when I asked them, do you circumcise your child? Most of them say no. But I love some honest people that say yes and no. So why did they say yes and no? So no, because they don't do the cutting anymore. They don't take the baby or cut with blade or anything like that. But they still do some other things. They see press it down. They will press it down or massage it or tuck it in or put powder and all that. All those things are non, they are all still part of FGM, and it is wrong and it is not. So any procedure you do to the female genitals for non-medical reasons, it is regarded as female genital mutilation. And this thing is actually counted as a violation of the human rights of our girls, of our women. It's a violation of human rights of them. So I know many of us do it for various reasons, religious, cultural beliefs that we have inherited from our whoever started them. And lots of mothers yesterday who answered yes, I was asking them, so why do you do this? And some of them told me, oh, because the girls will be seductive. The girls will be seductive and they don't want their girls to be seductive. And I asked the question, how do you know that the girls who are not circumcised are seductive, are more seductive than girls who are circumcised? I hope you know that there are lots of countries of the world where people don't do female circumcision, and I don't think the girls are more seductive than the boys. And I now find out that from further conversation, because I like having conversation with mothers, I like to know what people think in their mind. And some mothers were telling me, oh, because the thing was disturbing the girl. And I'm like, well, how do you know it was disturbing the girl? What is it? What does that mean? Okay, because the girl was touching the genitals. So I now realize where we're coming from. So it is pure ignorance and lack of understanding of how children develop. So when children are developing, for us as medical people, we talk about what we call the orogenital stage, where children get pleasure by what they put in their mouth and by how they feel their genitals. It's a normal part of development. And I see mothers always telling me, oh, my girl is always putting their hands there, or the boy is always touching their pennies or the testes and all that. And mothers panic about it and they think, oh, my girl is masturbating, it's a child. At that age, children, they don't have that level of knowledge of what is masturbation or all that. But they just realize that when they touch certain parts of their body, when they put this in their mouth, when they touch their genitals, they feel a lot of pleasure. And so that is a phase between 0 to 3 years. It's what we call the orogenital stage. All children pass through that stage. That's when you give them crayon, they put it in their mouth. You give them anything, the first thing is that they put it in their mouth. It's a normal phase of development. Then after they get to a certain stage, they stop putting things in their mouth. The same way they touch their genitals is natural part of development. It does not mean your child is being disturbed or is seductive or anything. Nothing is disturbing the child. The same way the boys touch their penis, the same way girls touch their vulva and all that. It is not that the girls are seductive. Okay, and I know many of us who are listening to me were not circumcised, and I don't think you think you are more seductive than other people. And I think everything has to do with lack of understanding. So we need to understand that first. So you need to understand, number one, why are you doing this? And number two, you need to know what are the implications of what you do. So if you don't stop it for the fact that the reason why you think you're stopping it is even not something valid, then you now need to stop it because the complications that you are going to give to your girls, you need to understand that you're causing harm to that girl child rather than doing any good. And what you think you're even trying to do is there's no basis for it at all. Because many of us are not circumcised and we're not seductive. And many of us, many people that are circumcised could be seductive. It has nothing at all. So that is from those who believe in that aspect. Okay, so there are lots of complications that come with female genital mutilation. Lots of complications that come with it, both short-term and long-term complications. So short-term complications, bleeding. We've seen children bled to death in the process of them being, say they are being circumcised or they are cut, or we've seen them go severe pain. You can imagine most of them do those kind of procedure without any form of anesthesia. Most of us, even to ordinary circumcision for the boys, it has to be done under anesthesia, or you have to put some something there to reduce the pain. But these girls are circumcised, so the girls go through severe pain. Very young girls bleeding, and of course, most of the time is done. They can bleed in a way that they can go into shock and die from that procedure. Apart from that, you also see that girls can have infection because from most of this procedure is the same thing they will use for everybody. At the same time, no hygienic process, nothing, and all that. But even when people do it, they say, "Oh, I'm going to go to the nurse or the midwife to do it for me." But you remember the pain, the shock, the bleeding is still always possibility. And then the girls have difficulty with passing urine and all that. These are even just the short term kind of complications that girls will have. But more importantly, with the long-term complications has to do with their sexual health and reproductive health and even their mental health. So a lot of girls that have been circumcised, they don't have pleasure when they have sex later on in life. And because most of the sensation and all that you feel come from that the clitoris that has been removed. I'm going to tell us about what they do when they do circumcision. And so a lot of girls end up having sex and not having any form of pleasure. And I wonder why women are also the same people that are still championing this cause for our girls. So we're not even talking about those of you that have already had the procedure. The question is, why should you continue to perpetuate this ignorant practice for your own children in this 21st century? In this age where we all know things, where we have knowledge and all that, we can excuse those who are doing it because they don't know much. But we that we now know better educated in this knowledge age, this is not acceptable. So this are thing. Then some of them, the way they do those things, some of the procedure, the way they do it, it's making it difficult for the girls to even have babies. Or some of them, when they want to have baby, because they've narrowed down that area, is so hard. So most of the time, we have to end up doing surgery for them to have babies. So this is has implications. Some of the children, because of the infection they suffer during the process of the procedure, they already develop what we call pelvic inflammatory disease. They develop infertility. These are very serious complications. So be thinking about it. You want to do some of our women today that are going through some of these things, some of the challenges they are facing may be as a result of these issues that they've passed through as a baby, during the process of circumcision. So, and of course, mental health. Many women today, some of them are depressed because they know they can't enjoy this. They just know there's something more that they should be having, and now they can't, So these are complications that female genital mutilation will cause. So what is the goal? The goal is to end female genital mutilation by 2030. I look forward to that day. And it's not really that far away. So we are now in 2022. So we have 8 years to get to this this plan to reduce female genital mortality. And like I said, Africa is one of the countries where female genital mortality is being practiced the most. Africa. And of course, Asia, there are about 30 countries. And I'm very sad that Nigeria is one of those countries where we still have a lot of our culture still practicing female genital mutilation. Also, some of us, even when we travel to countries like UK, and places where Europe and places where female genital mutilation is a criminal offense. If you do that in UK or some other countries, you'll be arrested, you'll be put in prison. It's a criminal offense. But what do our people do? They carry their children, they travel outside the UK to go and do the procedure and then come back, because they just want to, just because some people say, no, we don't have to do things, because people say we should do it. We should know why we do what we do and what is the benefit or what is the uh, side effects and what are the consequences of everything we do. So, despite all this, we know that a lot of places female genital mutilation is still, even among immigrants that have traveled outside, even in Australia, North America, New Zealand, places where you dare not do it. But people that travel, immigrants, they still keep on practicing. And due to COVID now, we believe that because during COVID, people that you would have prevented from having female genital mutilation, about 2 million cases must have happened that we couldn't even prevent because of COVID, because we couldn't see children, we couldn't prevent some of these things. So please, it is not just about, oh, why can't we do it? It's about culture, it's about tradition. No, it's about the consequences, the implication, the serious implications for the sexual and reproductive health of our girls. So we don't want our girls to start having difficulty with having children. We don't want our girls to grow up not enjoying sexual intimacy, because they've been circumcised. So I'm begging you and I'm encouraging you, let it stop. If you have been circumcised, let it stop with you. Don't perpetuate it. And if you are one of the champions of female genital mutilation, because from our experience, we found out that it is women. It is not the men that are saying women should be circumcised. It is women that are insisting that women should be circumcised. But I would yesterday I was encouraged because lots of women say, I stood my ground. I told them, no, I'm not going to circumcise my girls, and that's it. I always tell mothers, you are the ones that carried your babies for how many years and whatever. So you are the one that needs to stand your ground and say no to female genital mutilation. So, what are the different types? There are about 4 types according to the World Health Organization. There's a type where they just, remove partially or totally the clitoris. That is what majority of people do. And there's also the excision type where they remove not only the clitoris, for those of you who are familiar with the female vulva, they remove the clitoris and the labia minora, that's smaller lips inside. And sometimes they even remove the labia majora, that's the one that you see mostly on the outside. So that is like removing the entire external genitals of these girls, all because of a tradition. Another one is where they even not only remove all those things, then they narrow it down. They make the opening just a little bit for urine to pass through. I mean, those ones are the ones that will struggle with having babies, because the babies will not be able to come out of the of the area. You'd have to say then when they want to have babies, they have what we call obstruction in labor. And then if they are not in a place where they can be operated, some of them, that's why we have a lot of women also dying during delivery, because some of them have obstructive labor, and some of these obstructive labor are rooted in this female circumcision, this third type, infibulation. And of course the fourth type is any other thing you do. So those of you that are using hot water to press, those of you that are using powder to press, those of you that are using Vaseline to tuck it in, to massage it, please, let's stop it. All those other things we do, piercing, incising, scraping, any other thing you do is classified as number 4 type of female. And I think most of us in Nigeria, maybe we are in number 1 and 4, really, and we really need to stop it. And like I said, type 1 and 2 are the most common, where they remove either the clitoris partially or totally, or where they remove everything, the labia minora. So there's nothing there to show that this person is a girl underneath that place. So these are very dangerous practices, and that we need to stop, and we need to remove. We need to stop it. And so today, I want to encourage all of you not to practice female genital mutilation, because I've told you about the consequences both in the short time, infection, the bleeding, the pain. Some guys go into shock, you know, it's for what? No medical benefit whatsoever. And of course, long-term sexual health issues, reproductive health issues, mental health issues. So these are, so we are doing female genital mutilation does not cause any benefit to the children. It actually puts them at serious risk, and we really need to stop it. So I think I'm going to round up there and encourage you, not number one, not to practice, number two, to go and where, if people that are practicing, be the evangelist, be the ambassador of the news, and tell them there is no need for you to circumcise your female child. There's no basis at all for it. Stop it, and hopefully they will get to stop it. Okay, and then let's let the change start with us. This is our generation. We should be the one. I mean, our mothers may have done their own well, but we now, we are a different generation, so we should, no girl in 2022 should be circumcised. And I know people are telling me, oh, people that need to hear this message, they are not on YouTube, they are not on Facebook, they are not on social media. But you that you are listening to me, that you're on social media, you know where these people are. They are in your villages, they are in your town, they are your family. Tell them, educate them. This is why we're having this. That's why we have a whole day this devoted to this. Let's educate them. Let them know that they are doing harm to the girls, and it's a violation of human rights for them to circumcise the girls. It doesn't cause any benefit at all for our girls. It was those practices in those days where women are being subjected to unnecessary things. And now it is 20th century. Please, it has no basis at all whether your girls will be promiscuous or seductive, whatever you call it. No. You train your girls well, you educate them, they are educated, they are, they are the leaders in their place of work. They don't need to be promiscuous. They don't need to go and do prostitution. And it has nothing to do with the fact that they have vulva or clitoris or not, or whether they are circumcised or not. It has to do with your way you train up your girls. And that is what we should do as mothers, as advocates for our children. So I hope I have been able to clearly educate us today. And so I will just go now and take questions. So feel free to ask me questions, ask questions about FGM. You can also ask other questions you have. But today we are really putting a spotlight on female genital mutilation. We want people to know about it. And I want you to also share this news to all your friends and family. All right, Busayo, good evening. Sarah, good evening. Good evening. Okay, some people are calling their friends. Thank you. Princess Confidence, thank you for calling your friends to come and join us. Okay, yeah, thank you. Okay, lots of people calling people. I've not seen any questions. So please, if you have questions, let's talk about it. I'm open to listen to you, and then we can talk about it. Let me go back to Instagram as well. And on Instagram, I can see all of you that joined. Thank you for coming. So many people joining from Instagram. I mean, Bola, thank you. Chami for King, you have a question about your 7 months. It's always doing as if he has colic. And ideally, 7 months we should not be having colic. The stomach pain disturb us sleep. It happens only at night. Please help. I'm not sure that is colic because at 7 months is very, very unlikely to be colic. So at 7 months, we expect colleagues to have stopped. So I don't. You didn't really say what it is. You can't, because babies don't talk. I'm sure they've not told you they have abdominal pain. So it's just your own assumption. So a baby moving their body in their sleep does not mean they have colic. Baby moving their body when they are passing gas or passing stool. There's nothing wrong with that. There's nothing. When we talk about colic, we're talking about a baby crying and crying for no absolutely reason. That's the definition of colic. So I'm not really sure what your baby is doing that you think is making the baby have colic. But there are, like I always tell mothers, there are several reasons why your baby could be crying, and you really need to know why. Okay, so mentor mama say my daughter of 2 years has chest infection. Okay, people are not asking me questions about FGM. People are asking their own questions. It's okay, it's fine. Feel free to ask other questions that you have on Facebook, on Instagram. Feel free to ask your questions, and we will see answer them. But we just want to put a spotlight on FGM today. Mental mama say my daughter of 2 years has chest infection, cough and catarrh. Pediatrician gave her medication. What can be done so it doesn't reoccur? Okay, so in terms of prevention of chest infection, um, how do children get chest infection? Usually it's from other children or adults who have chest infection. So one of the ways to prevent is to make sure you keep your child away from people who have chest infection. For example, if you're going to crash and all those places, you need to make sure they're actually following proper protocol. Like if a child is sick, if a child is ill, the child should stay at home. And then, of course, make sure that you have taken all the immunizations, your penta vaccines, and not only penta vaccine, which has Haemophilus influenza, and also your pneumococcal vaccine also prevent pneumococcal infection, which is one of the commonest causes of pneumonia. Also, this area, your meningitis vaccine, even though it prevents the bacteria that cause meningitis can also cause pneumonia. So your measles vaccines as well, because pneumonia can also come from measles. But more importantly, also make sure nobody is smoking around the house. Make sure you don't cook or fry or do things in the house that smoke that the child can irritate their airway. So those are things you can do, and your child should not have chest infection. As long as children are exposed to other people with chest infection, they can always have it, but you have to do your best to reduce it as much as possible. All right, let's move on. Okay, I think that's all the questions I have on Instagram. I seem not to be having questions today. What's happening? Okay, is it because people don't want to talk about FGM today? All right. So Evo Wheezy say, my girl is 9 months and I found out that I have taken him. Okay, you mean you're pregnant. So please, should I stop breastfeeding her? Okay, no, you don't have to stop breastfeeding her. Um, there are two ways around this. Okay, number one is you can keep breastfeeding as long as you are comfortable with it, and there's nothing wrong with that. But if you think you are really, some women in the first trimester, they are really very sick, vomiting, and they are very ill themselves, so they don't even have that energy. They are barely eating, and so if you think you are not able to cope, yeah, it is fine for you to buy age appropriate formula and wean the child, but you're putting that child at risk of so many other infections from the fact that the child is not being breastfed. So you can breastfeed if you are able to up to it. If you are not able to up to it, please use age appropriate formula, but that is also has its own risk. Anyway, the bottom line is let's avoid this scenario. I always say it all the time. Let's avoid this scenario by doing family planning. Family planning, once you are 6 weeks postpartum, when you go, most mothers ideally you should go for a checkup after 6 weeks after giving delivery. So that is what we call postpartum check. So when you go for that your 6 weeks postpartum check, please do family planning. Breastfeeding is not 100%. It's not. So please do family planning. As long as you are having sexual intercourse and you are not on any family planning method, you can get pregnant. And it is not a good thing for your own health as well. And also for the new baby, there are lots of risks associated with this. So I know mothers, oh, let me just quickly rush my babies and finish. No, you're putting yourself at risk. And we live in a country where our mothers' rate of death is so high. Every day on Facebook, everywhere, somebody is passed on during delivery, babies. No, it's not a good news for us. And I think we can do ourselves a lot of good by also trying our best to avoid this scenario. So let's space our pregnancies. Let's recover first. We have not recovered from the other pregnancy, from the breastfeeding. You are going another journey. It takes its toll on us. We want you to space your babies by at least 2 years. Okay, so this is just an opportunity. I'm not picking on the person who asked question, but it's an opportunity to educate all of us. Let's space our pregnancies. Let's do family planning. It's one of the child survival strategies. we are pediatricians, but we are very, very big on family planning, because if you plan your babies, space them, we know you, because you are so important to us as a mother. Without you, we know our babies cannot survive. We need you to breastfeed them. We need to take care of them. So we don't want anything to happen to the mothers. So we want you to be strong. We want you to be healthy. And one way of doing that is make sure you space your pregnancies so that you recover fully before you embark on another journey. 2 years minimum is what we recommend. Okay, first we just say people are now back to ask me questions. My By the way, I forgot to mention that if you want to join our first time moms group, you are welcome to join us. The group is running now. Our live classes are starting in March, and so I think we're going to do a tester class in end of February. So for everybody, it's going to be free. You can just come, have an idea of what is the group is going to be like, and then after that, of course, you know how much it costs. It's 20,000 naira for the 12-week course. So join. But the good thing is that you are in the group. You can ask your questions. The pediatricians are there with you 24/7. Okay, somebody say my baby weighs 3.1 at birth. It's 5.6 at 14 weeks. Is the weight okay? Yeah, the weight is okay. Keep on breastfeeding exclusively. I hope you're breastfeeding. Okay, so Princess Confidence is saying, how about persistent catarrh? We've been to hospital for treatment and all that. I'm not sure you've not told me the age of your baby. You didn't tell me the introduction to this question. So it would be nice to tell me a little bit more. So which what is this child that we're dealing with that is having persistent catarrh? And when you've been to the hospital, what were you told at the hospital is the cause of the catarrh or the nasal discharge? Because that is what is it going to determine uh, the advice I'm going to give to you, because it's not natural for a child to be having catarrh all the time. Some children have it recurrently because it's allergic condition. So what we call allergic rhinitis. So the treatment for a child who is having catarrh because of allergic condition is going to be different from a child who has catarrh because he or she is exposed to another child who has catarrh, and it's not going to be the same advice for a child who is going to crash and is getting exposed to other children who are having respiratory tract infection all the time. So this is why we always want background information. So you may have the same issue, but your background may be different, and that will determine the kind of response that you get. So, Princess, just tell us a little bit more about your baby, how old your baby is, and what your doctors have told you as possible cause of the catarrh as well. Okay, Ọlọ́run Táyọ̀ Olanike Ajoke, good evening. My baby is a year 6 months. I just noticed that he cannot place his left leg to walk. He cannot use his left leg to walk. What happened? Did he go for any immunization? Did he get any injection? What happened? You need to tell us that information, because if a child suddenly stop to walk or not use a particular leg, something happened. It doesn't have to swell up. It doesn't mean that it has to swell up, but there's something may have happened. So we need to know that. So if your child did not have any injection, immunization, or anything on the buttocks, you will need to see a doctor immediately. And I hope your child also had all the polio immunizations and all that. So please see your doctors, and then you can ask your questions. Okay. All right, Princess is everybody's thanking you because you are calling all your friends to the group. That's good. So everybody should call your own friends too, like Princess is doing, and your friends can thank you. All right, let's go back to Instagram. Okay. Where did I stop? Instagram. Where did I stop? Okay. Okay. Yes. I think I know where I stopped. Okay. Yeah. Luato saying good evening. Chami for King. Say your 7 months baby has rash on her neck. A tuberculin was prescribed, but it's bleaches are, you need to stop and see the doctor will prescribe it. It's important for us to know that, number one, there are different kind of rashes. The kind of rash depends on the cause of the rash, and the treatment depends on the type and the cause. That is why I'm always so amazed whenever people are posting on our Facebook group, and maybe when we are still trying to answer the question, some others will just come and say, "Oh, go and buy this, go and buy that," and I'm like, seriously? How do you know which one to buy? How do you know? Some others will just say, "Oh, my baby has this rash. I've used this cream. I've used that cream," and I'm like, "How do you know that's the right cream to use?" And what we don't know that sometimes using the wrong treatments may worsen the rash, it may make it worse. So please don't just use any cream. And if a doctor prescribe it for you and the thing is not giving the response that it's supposed to give, then you have to go back to the same doctor and let them have a what we call follow up. So many people always ask that question. You've been to your doctor, they give you a treatment, it didn't work, or it didn't work properly, or it causes another thing else. The right thing to do, the right answer is go back to that same doctor, go for what we call follow up. That's why we always do follow up. In fact, most of us would have told you that I want to see you back in 5 days or in 1 week or in 2 weeks for follow up. So it is natural for us to do follow up. So because sometimes we know that what we've recommended may not work, or it may not work the way we want it to work, or it may have side effects. So the right thing to do is go back to the same doctor and let them see what has happened. So it's either they make alternative recommendations for you, or if it's something that doctor is not really because we also have different kind of doctors. So we have for our general doctors, we have doctors for each, we have doctor for pregnant women, we have doctor for children, we have doctor for each part of the body. So if it's the eyes, we have the ophthalmologist. If it's the ear, nose, and throat, we have the ENT doctor. If it's the skin, we have the dermatologist. So if as a doctor we are treating a particular part of the body and we are not making progress or we're not getting the response we want, we may want to refer to the specialist for that area. So if it's like your own case, it's a skin rash, we may want the dermatologist to have a look, because if the general doctor have done what they think is the right thing to do and there's no progress or there's no change, or there's things are not yet where we want it to be, then it may be prudent for us to say, okay, maybe it is time for you to see the expert, who is the dermatologist. And sometimes even for dermatology, we have the adult one, you have the pediatric one. So sometimes that's the right thing to do. Okay. I hope that's for Bookie. I hope so. My 6 month had cradle cap. Okay, what can I do to cure it? This is the second time of it happening. Number one, I'm very always very reluctant to take mother's diagnosis, because sometimes you may be wrong. And that's number one. Number two, cradle cap doesn't tend to happen over and over again like that. So that's number two. So I will really say, because there are a lot of other things that can happen in the scalp. Everything in the scalp is not cradle cap. I'm more convinced when I've seen it myself. Or better say, you show one of my colleagues. But usually for cradle cap, there's no big deal. We usually ask you to just wash the baby's hair with the baby shampoo. Many of us always use soap, the same soap we used to bath our baby. That's what we used to wash their hair. And I always ask, why do we do that? Because you, as the mother, when you want to wash your hair, you go to the salon, you even if you don't go to the salon, you buy the shampoo, you wash your own hair with shampoo. But when you want to wash your baby's hair, you wash it with soap. That's not right. So use the baby hair shampoo. There are hair shampoo for babies, so that you can wash it thoroughly. For cradle cap, you may want to put like olive oil in the evening so that it could soak. Because what happens in cradle cap is that you have like dandruff. That is it. That is underneath the scalp. So you put the olive oil to soak it. Then you use your shampoo, baby hair shampoo, to wash it, and then you comb out all those flakes, and that's it. So if there's something else going on your baby's scalp beyond that, yeah, it may not be cradle cap, and you may want to see a doctor for that. Sometimes, if it's a mild one, what I just said alone will work. Sometimes, if it's not a mild one, some maybe it's really, really bad, then we may have to prescribe a kind of specialized shampoo for you. That has to be prescribed by a doctor, a pediatrician preferably. So you have to see a doctor. So because you gave the impression that this is the second time, so I assume if it has happened before, you must have done something for it to have gone, then for it to have come back again. So the question is, what did you do the first time? And then why is it coming back again? So that alone worries me, that I'm really sure we're dealing with the cradle cap. So if you are not sure, you can post the picture. I hope you know that you can always post your question on our Facebook group from Monday to Saturday, and you can put a picture on our Facebook group, which you can do on the live program. So if you put your post it there, we can give you further advice. I hope that's helpful. Neck curls, hair wonder if you accept international volunteers. Yes, we are happy to accept international volunteers. With a lot of volunteers we do take, whether or you can work for us online virtually, and we also have, if you want to come down to Nigeria during our outreaches, you are more than welcome. So if you just go to our website, you will see where you can sign up to be a volunteer for HCP, our giving away page actually. So just check it out, or you can send us a DM on Instagram and we can send you the link to sign up. You're more than welcome. Okay, I think that's all the question. Okay, is there a question in the? Okay, somebody wants to join this video. Okay, thank you for all the questions on Instagram. Let me quickly see. Seem to have got a lot of questions on Facebook now. Okay. My baby, good evening, doctor. My baby of 6 months, can I start solid food? Your baby is 6 months old. I think that's what you meant. And can you start solid food? Yes, you can start. I will encourage you to go to our Facebook group, go to the guide section, go to the complimentary feeding guide. That is guide number 2. Watch all the videos, read all the articles there, watch all the ATP life on complimentary feeding. Make sure you prepare first, understand what is complimentary feeding, how to go about it. When you do that, before you start, it will be easy PC, or else you're going to come back and ask us several questions as well. Okay, Princess saying your baby is 13 months old, test results show malaria and typhoid. Treatment with injection. Is it the baby that is having catarrh that is having malaria and typhoid? Okay, let's start by saying that I have a lot of peeves. Okay, let me put it that way. I have pet peeve for those Lagos hospitals or whichever state of the country that all the diagnosis they ever make is malaria and typhoid in Nigeria. Most of them, I would say 90% of them don't know what they're doing. That is the honest truth. Okay, so all the time your baby is always having malaria and typhoid, and they're always on anti-malaria and injections. Most of the time, it's very unusual for children to have two things at the same time. They usually just have one. And yes, and there are many things children can have, and typhoid is not as really common as they make you believe. And most of the tests that people say they are doing for typhoid is not really appropriate, and most of them don't even do it properly. So why that is not how most doctors diagnose typhoid fever, but I think Nigerians just say do malaria and either, and they make it diagnosis. So, and they're always positive anyway. So I worry about those kind of hospitals. I would recommend you take your child to a government hospital, preferably either a general hospital or a teaching hospital where they have pediatricians to see your child, and they do the right thing. So otherwise they'll just be doing these things and it's not appropriate. So that's my own pet peeves anyway. I know I'm right. Okay, Akinoye say, is it possible for children to have TB? Yes, children can have tuberculosis. That's why we give them BCG. Okay. What are the symptoms? Then TB is not just a TB is a bacterial infection. It's a mycobacterial infection. It can affect different organs of the body. So you can have TB of the lungs or TB pneumonia. You can have TB of the lymph nodes. You can have TB of these, even the brain, TB, meningitis or TB encephalitis. So it depends on, so there's nothing, so the way you say, what are the symptoms? It depends on which parts of the body the TB is affected, but most of the time the children will be losing weight, they're not gaining weight, and if the child has pneumonia, they'll be coughing. If the child has meningitis, they'll have fever, they have convulsions, they may be unconscious. So if the child have TB lymph nodes, you see swelling, either on the armpits and all that. So I think we've done TB as a group discussion before. You may want to check our Facebook group and read about tuberculosis. And but it's a condition that is possible in children, and you must take that child to the hospital, preferably a government hospital, preferably a teaching hospital or a second level hospital. The treatment is free. The anti-tuberculosis drugs are free, but we need to treat the child quickly and promptly. So yes, children can have TB, and that's, in fact, children having TB is actually more difficult because it's so difficult to diagnose children who have tuberculosis, because unlike adults who cover sputum, and we can use the sputum to pick up the acid fast bacillus of tuberculosis, we usually usually don't usually do that in children, but there are other ways by which we pediatricians go around this. We do X-rays, we do other tests. So you need to take this child to the hospital and let them be treated properly. Okay. All right. Angela Moses, how can I help a forgetful child? Okay, let's start by how old is this child? What do you mean by the child is forgetful? All of us forget things from time to time. So I really need, I think I have an idea what you may be saying, but I really need you to be very specific. So what do you mean? Is it that this child, when the teacher teaches them, the child forgets what the teacher has taught him, or what are the really other things? You need to get us more, because that will tell us whether it's a child that needs to see a developmental pediatrician, it's a child that needs a developmental assessment, or what? Or is it a child that has like maybe ADHD that tend to forget things? Not that they have any learning difficulties, but because they're always too poor attention and all that, then it tends to forget their food and their bag at home and at school and all that. They're very careless and all that. So so you need to very, very, very specific in what kind of children you mean. Okay, thank you. Um, Another Facebook user is saying, my breast is not lactating well since I gave birth to my baby. Your baby is 4 months already. And she's feeding with formula. Please, can I change for formula? It's feeding with formula. Please, when can I change for formula for her? I don't understand. Oh, do you mean that when do you switch the formula from the brand you are using to a different brand? So the people that wrote that make formula, they always specify the age for which they want your child to take it. So some of them will say 0 to 6 months. Some say so just go by the age on what you're using. So if they say 0 to 6 months, then you change it to 6 months. So it's always written on it. Yeah. Good evening, Simon. Good evening. Okay, Angela is saying my baby is 8 years old, I hope, and very forgetful and easily distracted. Okay, now you're giving me more information. So if your child is 8 and is easily distracted and all that, then I worried about things like maybe ADHD or maybe learning difficulties. So this child needs to see a pediatrician, preferably a developmental pediatrician, so that we can do a proper assessment and then we can know what is exactly the cause of this child's difficulties, and then we can now make recommendations for management. Okay. Princess is right, government hospital. I think so. I prefer that. I know government hospital can be a pain in your neck. They waste time. They are too busy, but most of the time they tend to have real professionals, quality professionals. Unlike private hospitals, some of them there are a lot of quacks, and some of them don't know what they're doing. That's the next truth. So, Ọlọ́run Táyọ̀ Ọlánìkẹ́, Àjọkẹ́, okay, your baby, hang, you're not talking. You see, don't leave out important information. So if your baby just finished taking injection and stop walking, that is more important. That is a complete information than just saying your baby stop walking without telling us what happened before. So yes, this your child has developed what we call traumatic neuritis. So it means that they've injected the baby most likely on the buttocks and they've hit one of the nerves that supplies the legs, and that's why the child has stopped walking. There are two things that could have happened. So it could just be just that traumatic neuritis that they touch the nerves. So you have to take the child to the hospital. The child may need physiotherapy and all that. Depends on how serious the damage to the nerves is. It may take several weeks before the child is able to walk. But if it's a mild one, the child will start walking in a few days. Sometimes babies that have polio, when you give them injection, they stop walking. So polio sometimes can also present this way, and because most of the time, why are you giving the children injections? Because you think they have fever and you want to treat them. So sometimes people say it's malaria. It's not malaria. It's maybe polio, and then you give them the injection and the children stop walking. So this is why we always say every fever is not malaria. People should not just So I strongly recommend you go back to the hospital. I don't know whether I should say you should go back to the same hospital where the issue happened, or you should go to a government hospital this time around, because we need to know whether your child has polio, because usually any child that stopped walking, we do what we call acute flaccid paralysis surveillance. We need to rule out poliomyelitis in them quickly. So usually they will take stool sample and then they will send it to the lab and then they will come back. But more importantly is the treatment, usually physiotherapy And let's hope it's not something so severe. Some children will start walking again and all that. But the child needs to be taken to the hospital. And let me quickly rush and say, please let's stop taking injections on the labs for the on the I say labs on the buttocks for the girl for the children. It's not good because these are the complications of that. Generally, pediatrician, we don't like injections. We really don't like. I don't know why Nigerian mothers like injections. It's actually not good, and it doesn't work faster than oral medication. Unless your child is vomiting, unless your child cannot drink, unless the child is vomiting and the child cannot drink, that is when you should take any injection. Most of it, the children are walking, they are eating, they are running up and down. You want to take injection for what? These are the kind of side effects that can happen. A child that is not vomiting, can drink, can eat, that child should take oral medications, should take drugs by mouth only. The only time you're allowed to be giving injections if the child is unconscious, the child is vomiting, is not able to eat, is not able to take the drugs. Yes, and we pediatricians we prefer to give it into the veins. We set up a line. We don't like intramuscular injections, so we set up a line and we give the child antibiotics, anti-malaria, whatever we want to give. We give it into the veins. That is the preferred way. Now there are exceptions to the rules. Exceptions to the rules. There are some medication that we cannot give into the veins. We can only give it as injection. Very few, like some of the immunizations, for example, you can only give it as intramuscular. Those are our exceptions. And sometimes, of course, some children are their veins are so difficult, and we just want to save them. So sometimes we start with intramuscular injections, but we prefer to do it on the labs or on the deltoid, the shoulder pad here. That is what we prefer. We don't like that buttocks area at all because there is a knife called sciatic knife that runs through that place and it can easily be eat by the injection of the nurses. So please, mothers, if your child is not vomiting, stand your ground and say, I don't want injection. But do you know what? I know that it's the mother that will say, oh, doctor, just give him injection. Let's give him injection. Let us go home. He will not take the drugs. He will not take the drugs. We are causing more complications. So let's avoid it. So let's give our children drugs by mouth unless they cannot take it by mouth, vomiting and all that. Yes, so they are very unconscious. Yes. And then preferably government hospital where they will set it into the veins and not give them injections in their buttocks. If at all they have to do it, if they have no other alternatives, let's do it on the thigh. It's better. It's not completely 100% as well, but at least it's less risky compared to that of the buttocks. Okay, my time is up. 2 minutes to go, and I'll round up. My baby of 7 weeks has a creamy poop for a day and went back to yellow poo. A pediatrician said children on UBF can have any type of poo, but I don't understand. I don't as well. My baby feels well, no fever, generally fine. But the poo she had once, said, why do you want to worry about the poo she had once? At least the poo is now back to normal. So don't worry about those kind of things. Okay, there's really no need to worry. Your baby is fine. From what you've told us, your baby is feeding well, your baby is not in fever, your baby is not. So don't worry about it. So poo is the only time we worry about poo is either it is watery or it is hard or it has blood inside. Those are the things that worry us. Otherwise, a little bit change of color here and there may not make much issues, especially that it's just once off event. So don't worry at all about it. Okay, Amira saying, well done for the good work. Thank you. Can I deworm? You mean yourself? You can if you want to deworm yourself. I don't know why mothers like to deworm themselves a lot, but I've asked the gynecologist before because I get all these questions all the time. And you can deworm yourself. But I actually wonder where do you get your worms from? Because if you eat well, you wash your fruits and you wash your hands, you don't play in sand, you shouldn't be exposed to worms. So I guess most of us also eat food from maybe open markets, or we eat fruits straight from the fruit store without washing them, because those are the places we get exposed to worms anyway. So otherwise, I really don't see why we always need to be deworming ourselves. But if you are not sure, of course, you suspect you may have worms, you can deworm yourself. For my children, we want you to deworm them only from the age of 1 year, and you can deworm them twice a year. That is every 6 months only, and that's if you live in those areas where worm is so prevalent. So for those of you who live in Nigeria, yes, but some people live in some other parts of the world where there are not much of worms, so they don't routinely deworm their children. So I know that Nigerian mothers in those places will be like, I need to deworm my children. No? So in some places they don't expect to be having worms because they expect you to have taken all the precaution. But those of us that live in Nigeria, our children play in the sand, we go to the farm, we eat fruits straight without washing them and all that. We have a high prevalence of worms in infestation in our country. So WHO recommends for those of us in those kind of places that we just routinely deworm our children twice in a year. All right, I think I've answered all the questions, and I think, oh, okay, somebody is asking. There's a few questions on Instagram. Oh, okay, yes, just one more question on Instagram by Lara. 19. Can I give my children of 2 years and 4 years typhoid shots? No, I don't recommend typhoid immunization for children. And that's not just me. WHO doesn't recommend typhoid immunization for children. Typhoid fever is it's a infection that tends to occur through food or water. So what we want you to do, so typhoid immunization is actually recommended for those travelers, those who are traveling to typhoid endemic area. Maybe there's been an outbreak of typhoid and you are traveling to those areas. Yes, you're allowed to take immunization because, just to protect you. But really, children don't need to be taking those things. It's not really part of routine immunization. What we want you to do is give our children boiled drinking water, prepare their food properly, let them wash their hands. That's it. Make sure that children, most of the people that tend to spread typhoid are people that are food handlers. Some of them may have typhoid themselves and they are not sick, but they can pass it on. So if you cook your own food yourself, it's better and safer for your children. But if your children is going through to school and they have to eat food at school, ideally the school should make sure that their food handlers and caterers are screened for typhoid fever to make sure they don't have typhoid in their stool. And they need to have taken all those precautions. But if you're not sure, then you may want to make sure you give your own children your own food that you are sure of the source, and they drink water that you've boiled. I know in Nigeria, many of us buy this pure water, but they are not really pure. Most of those water, people just get up behind their cupboard and put water together and seal it. And so don't be, and even some of the ones they call bottled water, some people adulterate all these popular brands. Some people adulterate, because it's just their bottle. They just wash it and put their own water that is as dirty as anything inside, and people will not know. So sometimes, even when people say it's bottled water, blah blah blah, I always tell them for children, you may be safer either boiling them or adding what's it called, some of these things like water guard and things like water purification and chemicals. You can also use that just to be. That's what we need to do in terms of preventing typhoid. We don't need to be giving our children immunization for typhoid fever. Okay, I think for the first time I really finished my ATP live right on time. Wow, that's amazing. I think that because I didn't have so many questions today, and I think because many people are not so keen about female genital mutilation, but no worries. Thank you so much for joining me. Just a little bit of announcement as I round up. You are let me see, I'm looking for the other announcement. Okay, so if you have any questions that I've not answered, feel free to join our Facebook group, and then you can ask your questions from Mondays to Saturdays, 24 hours daily. So you can ask your questions about children health issue on Ask the Pediatricians, about adult health issues on ATP Family, and about if you have experienced a child loss or pregnancy loss, you can ask on ATP Still a Mom Nigeria. And of course, we do ATP Live every Monday at 6 p.m. Nigerian time. If you want to have a private chat with our pediatrician, you can do that. If you want to have conversation with any of our professionals, you can do that. Just send us a WhatsApp message on +234 905 6916818, or emails clinicsatp@gmail. That's our ATP clinics. It is not free service, so you have to pay for that one, but it's very moderate fees. Of course, you are welcome to support us, support our outreaches. I'm so happy somebody asked us a question about that today. International volunteers, please welcome to support us. You can donate to our account. You can also donate on our website. Please follow us on all our social media platforms. We're on Instagram, we're on YouTube. You can watch all our past videos on YouTube, on our Facebook pages, on our website, www.axpediatricians.com. And on our website, you can also read about these topics, and I'm sure you will learn very well. So, thank you so much, everyone, for joining me today. And I will see you next week by God's grace. Remember, in our group, we also have our group discussions. Every Wednesday. I think this week we're talking about stools, so you may want to join us for that. So thank you. I think I really did well today that I finished on time. We'll see you next week. Bye. Bye. Bye.